Hello, everyone. Almost top of the week. I hope everyone's doing well. This is probably one of the very important, one of the most important Q&As we've had up to date because we're going into this new world of healthcare cost and things that are changing almost seems like a minute to minute. And it's certainly keeping me busy, a lot of people busy, and a lot of people concerned as to what's going on with healthcare, the cost, and your access to treatment. So the questions we have here, I'm not going to take the full time to answer these because we don't have as many questions. But going through this, if you come up with some questions, please answer them at the end. We'll be glad to cover as many as we can. And outside of that, should you go in and request a coach, I can help direct, be more specific to your particular situation. Or if you have any additional questions, you can direct them to us and we can get back with you and have those questions answered. Now let's go into the questions. Oh, please, before we go, please go back to that's like please scan this and join our Financial Connect group. It gives you the latest information out there that may affect you as a patient, whether you have cancer or not. Particularly, as difficult it is with paying for the cost of cancer, we know that's very, very expensive. So it probably affect you. Some of these changes affect you more. Please join our Financial Connect group. That's where I have gone through and deciphered and and concentrated down what information that you may need, so you can be aware of what's going on and you can make changes as needed to your plan. So please scan this QR code and direct you to our Financial Connect group. I'd love to see you there. Next slide. So the first question, so there are copay assistance programs that require an income level at or below 500 or 600% below the poverty line, federal poverty line. We make above that level and still need help because of inflexible expenses. Are there any grants that I might be eligible for? So unfortunately, a lot of these nonprofits and these programs, they have a income criteria simply because there are a lot of people who don't have access to financial assistance when they really need it. They have this income limitation in there. I would suggest that this person, whoever you are, I thank you for the question, is one that I have incurred myself in different times of my life. I would really ask that you work with a financial advisor who's aware of cost of healthcare, how those things are going up, and how just because you have a lot of money does not mean you have a lot of discretionary income. I think that's a misnomer. People think that, but there may be additional options that they can help with any kind of assets you may have to increase your discretionary income so that you can continue to pay for your healthcare costs. So I know that it's probably not the answer you wanted. And keep checking online. If it's medications, you might want to check with the pharmaceutical companies. Sometimes they are a little bit more flexible on that federal poverty criteria if they even have them. But I would suggest you work with a financial advisor. Reach out to me. I might be able to give you some direction. I am a financial advisor. I can possibly help you with some suggestions. But please speak to somebody because I know that it's still crunch time with you as well, no matter what your incomes may be. Next slide. I am currently on maintenance that is having Dara injections monthly and Zometa every 3 months. I don't know if you're looking for help on travel, help on copays or deductibles. If that is the case, I would direct you to healthcare, to LLS. They have financial assistance programs. If that is not the question, then I would suggest you reach out to me or one of the financial coaches. You can reach out to us through our financial coach website and ask for either myself or anyone who says they are a financial coach, like um, Patrick Kelly, Dave. My mind just went blank. I'm sorry, but we have quite a few financial coaches there that'll be glad to assist you. Ken Levy, who's probably on this webinar, he's a great financial coach. He has a lot of knowledge. He would be glad to assist as well. Next slide. I am currently on Medicare and Medicaid. Medicare covers 80% and Medicare covers the remaining 20%. I am 64 and will be 65 this year. I was granted disability benefits last year in 2024 after the myeloma returned and Revlimid failed after about a year. I was diagnosed in August 2021. My question is, if I no longer have Medicaid after the big beautiful bill goes into effect, will there be a way to apply for DARA that would be affordable? My answer to this would be, next slide. Good question. If you will be on Medicare this year, you should first make sure you're getting a plan that will cover your treatment and plans like Plan D for your prescription. I would suggest you talk to someone, go through, get all your drugs, get all of your treatment facilities, your providers together so you can do some really good comparables because Medicaid is getting crunched out. It is actually getting very serious on reductions on states because federal government sends money to states and states put their own money in and this helps pay for Medicaid recipients in the communities. So the federal funds to the states are being drastically reduced, if not completely eliminated, which means the states are at a crunch to try to figure out how to continue to help their beneficiaries, their patients, continue to get their Medicaid, their treatments, their health care, and um, not fall off the rolls. Unfortunately, a lot of people will be falling off the rolls. So my suggestion would be to talk to your state and health insurance program. They can help direct you on making some of these choices on your Medicare plan, and then do some comparisons. Make sure that when you're talking to a Medicare provider, that they are able to look at all of the plans in your particular zip code in your city, so you can make sure that you're getting the best plan for you, not just the one that that broker is going to be selling. That's very, very important. And then make sure you get either a supplemental plan. And I don't want to be, there's a lot of problems. You've probably heard of Medicare Advantage plans. And a lot of Medicare Advantage plans, you don't have access to know if that provider is still on from year to year. And their roles are not updated as they should be. In addition to that, Medicare Advantage plans can drop off even mid-year, and they will notify you. But the problem is providers are not looking at that notification date where you can continue to get care through a certain date. That is a problem that a lot of people are incurring. They're going to the doctor, assuming they can still go in with that Medicare Advantage plan, and they're falling off. Medicare supplement plans are completely different. Medicare supplement plans may have an additional premium cost, but their care overall is a huge network. Anywhere someone takes Medicare, they are required to take the supplement plan, unlike Medicare Advantage plans. In addition to that, you have to get a Part D standalone plan with a supplement plan. It's not put in one plan like your Medicare Advantage, but this will help you cover your meds as well. Um, when you start getting closer and you have 3 months before, the month of, and 3 months after your birthday to sign up for Medicare, I would suggest reach out and talk to somebody. If you want some additional direction, please reach out to me or one of my financial coaches. We'll be glad to help you on this process so that you won't have a drop in your coverage for your medicines. Now, if you have problems with paying for those, you can reach out to the pharmaceutical companies who manufacture that company or reach out to um, LLS, who help you cover not only your Medicaid reimbursement for Medicare premiums, but can help you bridge that gap. Next slide. I am having a hard time with Yale in neuroretic peptide tests, which is required because of chemo possibly affecting my heart. They sometimes don't charge me for it. However, in March, they billed it to Medicare, which paid $27 on it. Part G didn't need to pay. Yale is saying it wasn't paid and are charging me $177 for the test. Medicare says it was paid. I now get a letter from my oncologist on why I need this test. Do I send this to Medicare? You need to do an appeal. You need to get proof that Medicare paid $27 on it. Don't know why Part G didn't need to pay. Yale is saying it wasn't paid, which is your provider, and they're billing you $177 for the test. You need to get proof that what was paid. You need to get information from your Medicare that says they should have paid the entire amount, or there may have been a um, acceptable payment between the provider and Medicare on what they would get paid. You need to appeal this. The information should be on that Medicare statement as to how you appeal a Medicare plan payment. Um, if you have problems with that, give me a call. You'll need to send me a copy of your proof of payment, your Medicare information, and I can help direct you on what you need to do. So the office is saying it hasn't been paid, and you'll need to provide proof of payment to the doctor. You want to make sure your Medicare plan will be covered going forward, and an appeal may need to be put in process. And I would do that as soon as possible. Make sure you are aware of the time requirements when you're filing appeal for your answer or responding to something, because you don't want that time to go away and the appeal drops in a black hole somewhere. Reach out to me. I'll be glad to help direct you. Next slide. My husband has low risk MDS and is being watched at this time. We tried to eat a healthy way, but what are some foods that will help his counts? Now, this is not directed to financial things, but I would suggest you reach out to maybe some of the other MDS support groups. And I'm sure some people have gone through a lot of the same things you're going through. Their support groups are wonderful. People can share their experiences, whether it's their experiences with understanding your diagnosis, with treatment, side effects, with foods that seem to help. But I would direct you there. Your doctor should also, your provider should also have a dietitian that might help answer some of your dietary needs. Next slide. I am 63 years old and have been on disability for 2.5 years. My Medicare coverage will begin on October 1st of 2025. I am looking for a supplemental plan as well as a Part D prescription drug plan in New Jersey. And what would you recommend and what should I be looking for in a plan? Now, I can't tell you exactly what's there, although if you're looking for a supplement plan, which is the most inclusive in your networks, um, I would suggest you get a Part G, especially when you have an illness that you may need more than one specialist now or later. Because once you could first sign up, if I'm assuming you're on disability, which means don't have employer um, coverage, I would suggest you get a Part G. A Part G is the most inclusive of the Medicare supplement plans. And again, anywhere you go with the Medicare plan, and you have to have Part A and Part B in order to get a supplement plan, as well as a Medicare Advantage plan. I would suggest you um, talk to someone to give you all the options that are available to you, because you may have, let's say you got a Part G in a supplement plan. There are so many providers under there with so many different types of coverage, or so many, that they're all somewhat, they have to cover the same things, but they may have things a little bit different. The cost may vary as well. But I would suggest you look at a Medicare supplement plan, talk to a provider, start out with the state health insurance program. You'll hear me say this over and over again. They are a great resource to direct you where you need to go. So collect your providers' names, their addresses, your prescriptions, what your may go into if you came out of remission, so you can make sure your plan that you're going to get will cover that in the future. And then go through the Medicare site. They can help direct you as well. Um, and make sure you get a plan not that's just affordable, but that's going to cover all of your needs, including prescriptions. So if you're considering an Advantage plan, be aware of prior authorization requirements as well as your network coverage, because it's very limited. Next slide. Can you provide the major impacts of Big Beautiful Bill to our healthcare costs? This is a big, very complicated question. This could be a webinar or two in and of itself, but I'll try to break it down. So how will it affect the coverage under the Affordable Care Act? The subsidies are set to expire at the end of this year, which means if you went into the Affordable Care Act or Obamacare because the premiums were less expensive than going through your employer, then those subsidies, that additional help for your premium coverage, is going away. So those of you who are getting those subsidies will be paying more for your coverage, possibly between 75 and 200% more in your premium. So those who cannot afford Affordable Care Act may have options to get employer insurance if you're still working, or Medicaid if your income is so low that you can't afford the Affordable Care Act. And Medicaid is in itself, a lot of requirements on the Medicaid is going to be work requirements or volunteer requirements or all these requirements under Medicaid. And of course, like I said, the states are not going to be funded through the federal government as they had been in the past, which means the state Medicaid rolls are going to be very, very crunched. They may be pulling back on what they're going to cover. Um, so it's very convoluted. It's very complex right now. Hopefully, some of these things will pan out to the better of our patients. Um, but again, get on our Financial Connect and I will keep you updated on what's going on. I know where this question is coming from. It's a great question because it helps educate everybody on what's going on. Now, this is a question that has many parts to it. Let's go to the next slide. Medicaid, now how is it going to affect Medicaid? Medicaid will not be funded like it currently is by the federal government and the state through this to the states. The federal government in the new bill will be reducing their contributions to states, putting the states in a challenging position of covering more people with less funds. Probable effects will be hospitals closing, especially in rural areas, services reduced, more people without insurance coverage. And they're expecting up to over 10 million, possibly 13 million people will lose coverage. And they may not be able to get on the Medicaid roll, and they may not be able to get Affordable Care Act. And some of these people may still be working or may not be working. So it's going to be a big challenge for a lot of people out there, especially for people who have challenging and very complex health issues such as cancer. The next slide. I think this was we missed some slides. This was not the other one that I added additional information to. Okay, how do you seek, we'll come back to that. How do you seek a second opinion or a different doctor if either one is outside of your insurance network? So often you can request an insurance to make an exception for the second opinion, especially if you don't have a comparable specialist in your network. And sometimes they'll do not just a second opinion, they'll do a third opinion if the second opinion is completely different from the first opinion. You may have a third one, for lack of a better term, as a tiebreaker. But if your insurance network, if your insurance does not provide for a second opinion outside your network, you can ask for an exception. Next slide. What costs are typically not covered by Medicare Medigap plan? I know plans are individual and there are so many plans to select, so please answer in general. Well, this question is almost impossible to answer because of those things. There are so many plans to select, and I don't know what kind of illness, don't know the treatment plans. I mean, it's kind of easier to find out what your illness is, what your treatment options are, and then find the plan based on that. That's the best way to narrow it down. If you're going to do some good comparisons, instead of going on this global search, which take time, it's almost impossible to do, narrow it down to what your needs are going to be. That's the best way to find a plan that's more specific and better for you. So again, there are many Medicare plans under the same name as Humana may have, I don't know, 5, 10, 15 different plans in a Medicare Advantage plan, or Medigap plans may have 5, 10, 15 different plans under like Medigap Plan G. So it's better for you to find out what your goals are, what your needs are, what your network, your providers, your prescription coverage, all of those things, and then find the plan best for that, not what's typically not covered or covered under a Medigap plan. Next slide. I am thinking of applying for disability. My concern is that Medicare will not cover as well as my private insurance. As of now, my treatment and future stem cell hospital stay would all be covered. The physicians are out of network. Would you know how well Medicare covers for all this, including the medications? So this is very, very specific and a very broad need that you're asking. I will tell you this. If you're going to be applying for Social Security disability, whatever insurance you're on, you need to stay on that until you're approved for disability. Unfortunately, you may be through an employer. Um, and if that's through an employer and you apply for disability, there is this six in one and half a dozen in the other, where if you're working, then you may be denied disability because you're still able to work. Although you can work to a degree when you're on disability, but they like to to not approve disability as it is. So it's better for you not to be working and legitimately on disability in order to be approved for that. Disability is taking 2, 3 years to be approved. So you need to have some kind of coverage and some kind of income during that period of time. I always tell people to always, when you're thinking about Social Security disability, to think about where your income's going to be coming from until you get approved, but to also apply for Social Security supplemental income in that period of time. It's not a lot of money. It's less than $1,000 a month, but it's better than nothing. Especially if they hang out 2, possibly more years to get approved for Social Security, even if you have one of those existing healthcare issues that says Social Security will not deny it. The problem is they're having a hard time getting to the applications because their workforce was reduced almost 30%. So I would suggest you take those things in consideration. Timing is everything when you're applying for Social Security disability. Um, so Medicare will pay for what is under that particular plan. And that's why you need to do some really good comparisons, finding out what your treatment is, prospective treatments in the future, and what your prescriptions are. So what I would encourage you to do is to reach out to, it's kind of hard because waits are horrible on Medicare and Social Security. Reach out to Medicare.gov or to even a broker in your area, and they can give you some general information about this. They were going to ask for what type of treatment you have, where your hospitals are, what type of medications you're in, so they can do some comparisons based on what they have. And again, reach out to SHIP, State Health Insurance Program. Everybody is named as SHIP, but it's the state health insurance program in the state that you live in. And they can give you some really good direction with Medicare, Medigap, Social Security, all these things. They can help direct you to some providers or to some resources in your area that can help answer some of these questions for you. Again, reach out to our financial coaches. We can help direct you as well. The next slide. What can I do if my extra benefits will not pay because my doctor has been diagnosed with IgG kappa smoldering myeloma? Is it not true that all the phases of the disease is still cancer? Any information that you can provide would be greatly appreciated. I will tell you this. If you have smoldering myeloma, depending on who your doctor is, a lot of times, or your specialist is, now's a good time to get a specialist if you don't have one. I would suggest that you speak to that provider and ask them if they are even treating. If you're not being treated for smoldering myeloma and smoldering has not yet turned into full-fledged myeloma, then it's hard to be covered for something that you almost don't have. Um, and again, your insurance is going to differ on what they will cover. However, if a doctor finds something medically necessary, they may get a pushback from your insurance company, says we're not going to cover this. If the doctor finds it's medically necessary for your treatment, then you'll be doing an appeal, um, uh, peer to peer. Your doctor will be doing a peer to peer, or they'll be doing some kind of appeal to say, I need this, he needs this, this person, he or she needs this treatment, and this is what we are suggesting for treatment. And that way, we try to get it covered that way versus not knowing, where you are in your disease process and whether you will be covered for that treatment. Next slide. Are CLL meds included in Medicare prescription coverage? We have Humana PPO Part D. CLL is a cancer, a disease, and it is covered just like any other cancer. Um, is a copay included in the annual out-of-pocket cost so that they are covered completely after meeting a patient responsibility for an annual deductible, just like any other disease? Your copay is included in your annual out-of-pocket cost, and your depending on your plan, your once you meet your out-of-pocket costs, then your prescription should be paid for. This year starts a no donut hole coverage, and I wonder how CLL drugs were going to be considered in this change, just like any other drug that you take, whether it's for high blood pressure, diabetes, the coverage would remain the same. The donut hole does not specify any particular drug for any particular illness. Next slide. Again, do Medicare Advantage plans cover the multiple myeloma treatment cost? Medicare will cover the costs associated with biologic treatments. Make sure your providers and treatment facilities and medications are covered under your plan. This is what a lot of people forget to do, especially with, I think, medications. When you're on your medication or your prescription plan, and particularly if it's a Medicare plan standalone like a Part D, a lot of people are assuming that that $2,000 max out of pocket is as soon as I meet that, that all my drugs are going to be covered. It's not necessarily true. It's not true. What you need to do is make sure that if you're on a Medicare plan, a Part D standalone, you have that if you have a Medigap supplemental plan, or maybe rolled into your Medicare Advantage plan. You need to see what drugs are on their formulary. Um, Only the drugs on their formulary will be capped at that $2,000 max out of pocket. Be aware that some Advantage plans have changed their coverage mid-year, like Revlimid. Revlimid is no longer being covered by a lot of Medicare Advantage plans, which leaves people in a lurch, right? So if you have the option, and this is the wrong slide deck because I had taken that last line out. Um, be aware of changing when you can change it in a different plan D. If you find that some of your prescriptions are no longer covered, that may be an option for you. I would certainly review everything before it's too late to go in and change those plans. You don't want to be stuck next year or later on this year without any coverage. But I would certainly look into that. Most Advantage plans, Medicare Advantage plans, will cover most biologic treatment, and they're generally covering the same thing because Medicare is governed by the laws of the federal government. So I would check out the plans, and if you have the option to maybe go into a Medigap plan for a different Medicare or for different treatment options and facilities, because you have your network is broader. You're not stuck into a particular network. I would suggest doing that. And we can talk about that on the particulars of your particular issue. Well, we can talk about your specific issues. If you want to reach out to me via email or a call, I'll be glad to do that for you. We can discuss your thing at length. So there were, again, here is our Financial Connect group. Please scan this QR code. I will give you the latest, greatest on our Financial Connect group as to what's going on. There's going to be a crunch date for a lot of this stuff. Things are going to affect here relatively soon. A lot of states are beginning to put things in place, especially under Medicaid. A lot of our providers, especially rural health, doctors and healthcare facilities and hospitals are beginning to realize what's going to happen, and they're trying to be proactive in taking the steps they need to take now. Um, but there's still going to be a lot of people falling off the rolls. They're not aware they had to, if you're on Medicaid or you're dual Medicare and Medicaid, what's going to happen. You need to be aware of what's going to happen because it will affect you. Um, I want you to know that in addition to just Medicare and Medicaid, private employer plans, their costs are going to go up 7.5, possibly more percentage points. So affordable care subsidies are going away. There's a lot coming down the pike, and I don't think that we are all even privy to what's going to happen. So, what I do find out, I put on our Financial Connect group. I encourage everyone to sign up for that. It's invaluable. You can ask questions. I will answer those questions. We have other financial coaches on there who will give information as well. So, we want to make sure that all of your concerns and questions are answered. There was a question here, question 7, and I believe that was from Ken Levy, who puts a lot of great questions on here to make sure everybody is aware of what's going on as to what's happening in our environment right now. So there's a lot that's going to affect you. We talked about Medicaid, the work requirements. We talked about Medicaid not being supported by the federal government in your states. We talked about Affordable Care Act subsidies going away. Medicare, the premiums and deductibles and copays will probably going up across the board. And it's not your Social Security increase, maybe 2.7% has not been announced quite yet. It's not going to cover these increases. So I think everybody really needs to figure out what they have, the best plans for them, what they can afford, and find out if there's any creative income creating possibilities for them to help cover their cost of care. And I can help direct you to resources, or I can help educate you on some other options that may be available to you based on your particular situation. Now I'm ready to answer any questions that you may have or direct you to the resources that will help you.
Perfect. Thank you so much, Diana.
Hmm.
We've got a question in the Q&A right now, but I just want to remind everybody that if you do have any questions, this is your chance to pick Diana's brain, get in and ask those questions in the Q&A, and we'll get those answered as quickly as possible. So we've got a few questions. The first one asks, are there any tax deductibles we can leverage when getting treatment for myeloma?
Okay, so on the tax code, if you have anything over 7.5%, so you have to, for any of your um, treatments out-of-pocket cost, anything above 7.5%, you can write that off your taxes and you'd have to do an itemized tax return. When you're looking at an itemized tax return, now I'm not a tax expert, and I would suggest you talk to a tax expert to answer some of these questions. Um, you need to be aware of what your actual, as a single person, you get a certain amount, or as a family, you get a certain amount as a tax exemption. You want to find out if that 7.5% is going to be worth itemizing versus the other option. Um, but it would include anything out of pocket, whether you need to have, even if you had to have your home modified, you can use that because that was medically necessary. If you had to buy a car that had been modified for you to drive, that's medically necessary. That's cost out of pocket. If you traveled to get medical assistance or get medical help, all of those things are considered medical necessities and can be written off. But again, it has to be over 7.5% of what you've already spent.
Perfect. Thank you so much. Next question is back to smoldering myeloma, just asking if this patient would be eligible for disability benefits if they're receiving treatment for smoldering myeloma.
Very good question. Now, smoldering myeloma, you can be getting treatment, but it doesn't necessarily mean that you're disabled. Now, that doesn't mean that you don't have another comorbidity that's causing you to be disabled. So I will tell you this, that when you apply for Social Security disability, you have to really be deemed by your doctor as disabled and not being able to work. Because if that is challenged, and it will be challenged, it's either be denied outright and you can appeal it, and then you may end up having a, a judge to determine whether you're disabled or not. You're going to have to talk to him. You will be talking directly to him and saying, I'm disabled, and they will have your medical records. Your medical records have to determine or say that you are medically disabled. Just because you're getting treatment does not mean you're disabled. A lot of people who have full-blown myeloma, who are doing chemo and a lot of treatments, are still working because they may not be deemed completely disabled.
Perfect. In that same vein, we've got a question just asking about if we're not using an employer insurance or Medicaid, Medicare, what is the best insurance plan to use? Do we need to have really good insurance for life essentially if we have smoldering myeloma or multiple myeloma since we don't know when we'll need treatment?
That's a really good one. You never know. You're always waiting for that shoe to drop, right? And it may not ever drop, but you're always going to be aware of what's happening or what could happen and you're covered. If you don't have employer insurance, I'm trying to understand how you're covered at this point. Especially if you don't have Medicare, Medicaid. The only other option would be through the Affordable Care Act. Um, and then I would always get the kind of insurance if you have smoldering myeloma. I personally, I would try to make sure that I knew what the first line of treatment would be, so that at least I could be ready for the first line of treatment, that my insurance I would sign up for would cover that. because then you every year you'll always be able to go back and change your coverage, or if you got another job, you can get coverage for your job because you have a lifestyle change or a life change, and you can possibly look at other options after that. But I would get insurance anticipating that something can happen because you just never know until you go in your all of a sudden your blood results or something are off. I would prepare for that.
Thank you so much. I think that goes back to something we talk about often, which is just having good communication with your physician, seeing what they expect to happen in the future, and then hopefully being able to plan for that as best you can. So thank you so much. So our next question just says, do drug companies or testing facilities offer financial assistance for multiple myeloma drugs or testing?
Yes, they do. They offer for drugs, and again, they have their criteria around income, but generally they're and most of them, I would say most of them, they're used and they don't close down like you may have your LLS or your HealthTree. I mean, health well organizations that provide financial assistance. When you talk to your pharmaceutical companies, they're open year round for assistance. Even if you have Medicare, a lot of them have programs that will help people who are underinsured or uninsured. So, and then LLS and your Health Well or Cancer Cares or Patient Advocacy Foundation, African Foundation, they have programs as well, but they are dependent on whether they have the funds available and the income criteria. But you can usually always find help through your pharmaceutical companies.
Perfect. Thank you so much. And I know often that information is shared on our Connect pages and also through our Facebook pages as well. So this kind of is in that same vein, just asking about earlier, we had questions about grants. Can you remind everyone the best place to find information about grants, specifically within our website or elsewhere?
Sure, if you go to healthtree.org and put in your disease code and go through that, you'll find at the very bottom it says financial resources. And when you go into financial resources, it'll tell you nonprofits, it'll tell you, for, especially for myeloma, it'll also break down the types of medications and the pharmaceutical companies associated with the financial assistance. And it's not just assistance, it's education as well. And Jensen is one, for I'll just say, as for an example, has great educational resources for you, not just about the medication. It talks about your actual disease. It helps you with symptoms, and there's a dietary issue. They have a lot of information available to you to help you navigate your disease and the financial resources as well.
Perfect. Thank you so much. And we will include the link to our financial resource page in the follow-up email as we do. So we've got another question. It says, I'm 67, lost my job 2 weeks ago. I have supplemental plan and some Medicare now. Just diagnosed with multiple myeloma prior to losing my job. Was approved for short-term disability and have not started treatment yet. I'm so sorry, first of all, that you're going through this. That's a lot all at once. So our hearts are with you. But this patient is just asking, they need financial assistance for day-to-day expenses. What are your suggestions, Diana?
We have some of those things online as well, but I would suggest you have a lot going on, and you have a lot of things you have to do time-wise. Um, this person, I'm not going to answer. I want them to reach out to me directly as soon as you can, so that we can get you going, and so things won't fall through the cracks because there's things you got to take care of through your job. That's very time sensitive, and if you don't do it, you've lost it. So please reach out to me. I'm available for the rest of the afternoon. I will give you my number. I'm gonna give you guys my number on now because this is all of these issues are very important. My number is 502 500 6549. Again, I am available the rest of the afternoon to talk to you and other times through the week if you can't talk to me today, but I'll be glad to answer and direct you where you need to go to get these issues resolved. Okay? Please reach out to me.
Yes, thank you so much, Diana. I think times like these, we just see how much you care, and we're so grateful for your willingness to just jump in and help. So thank you so much. Also, if you want to reach out via email, Diana, we just let us know your email address as well.
It's Diana, as D as in David. You can, I don't know if you see here, Iahannna at healthtree.org.
Perfect. And we'll follow up with that as well. I can also send an email to the person that requested that question and make sure you guys get connected. So thank you for that vulnerability. That's a lot going on. So we want to make sure we get you the help you need. All right. Next question is, I'm on long-term disability, 63 years old, and my past employer allows me to keep my insurance for a short while, but to pay out of pockets for it. What do I do when my insurance runs out with my employer?
So the question here is if you're under your regular plan as if you were still employed there, or if they have you on Cobra, which is a plan that's it's not it's like you're it could be exactly like you're in your plan as if you were still employed there, but it's designated and federally regulated completely different from your regular insurance plan. So if you're on Cobra, you generally have 18 months. Sometimes your company will let you extend that, and depending on what your issues may be. Again, you are under a time crunch as to deciding what you need to do. 63, you're on, I think you said you're on long-term disability. How long that long-term disability will be in effect, if it's a long-term disability through your employer, they can actually request, and the plan documents will say whether they can tell you now you need to go get on Medicare or you need to apply for Social Security disability. And again, there is that big problem with Social Security disability getting approved. So again, reach out to me. We can help. I can help look at what your actual particulars are, and we can go from there.
Perfect. Thanks again.
Mhm.
Just got a question about insurance brokers. I know you've mentioned it a couple times. You know, it's really important to get in contact with good, reliable insurance brokers. And we touched on that a bit, I think, with our last webinar. What is a good way to find insurance brokers in your area?
If you call SHIP, SHI, the State Health Insurance Program, they can help direct you to brokers. Um, I would be very leery of those who are very, and I gave you that. Please, if you have questions about brokers, look at that last webinar, and Cindy could probably send it out to people who are interested in that. There's a lot of unfortunately, there are some issues with some brokers, and they should tell you that we don't give you all the information about all the plans that are available to you. They're required to give you that information. They cannot harass you. They cannot pressure you on a sales tactic. If they are, then that's not the broker you need to be with. You may not be getting the best plan for you. If you look at, again, if you look at Medicare, you can still, if the Medicare CMS.org or .gov will give you all the plans that are available to you in your area. They will show you all of the plans, and then you can do comparisons on there as well. You know, that's, you don't have to call them up. They have that online available for you to do it. So I would suggest you start there as well. Um, there are some reputable brokers. Again, finding the reputable brokers in your area, because right now they're really trying to get people geared and ready to get on those plans. I would ask them a lot of good questions. Do you offer all the plans? You know, what if I need to change my plan? What if I'm unhappy within 30 days? A lot of times you have a free look period for some plans. Um, you know, what if this doesn't cover what my needs are? How do you know that all of my treatment facilities, my providers, that my prescriptions are going to be covered? You need to ask these questions and provide them with as much information so they can do comparisons, and make sure you get a copy of everything they say they're doing, or that they say it's available to you, because that is going to be your go back to say, you know, that was what you said was not right. What is my recourse? So I would suggest you always cover yourself so you can have an out when somebody is giving you the incorrect information.
Perfect. Thank you so much. And I will link that previous webinar in our follow-up email. We've just got a question. So if anybody wants this information, make sure you've got a pen and paper handy. They're just asking if you'd repeat your number and email one more time, Diana.
Sure. My email address is Diana, which is D as in David, Iahannna at healthtree.org. My phone number is 502 500 6549.
Perfect. Thank you so much. And I'll have my email address up at the end of the slides as well. So if you missed any bit of it and you want to reach out to me, I'll make sure you guys get connected with Diana as well. So thank you. This one might be a little bit tricky because I know it can vary state by state, but do you know what the typical rate is if you hire an attorney to help with Social Security disability?
Oh, I can help you with that.
Oh,
I
excellent.
can't give you it's not an exact dollar amount. I'll tell you why. You can, and first of all, you can go to any disability attorney who represents people in disability. It doesn't have to be in your state because they don't have to, they are not um, held captive in a particular state, which is good. And if you want a really good attorney who's helped me and other patients as well, I'll be glad to give you his name and number. Use it for my son. Excellent. In addition to that, usually you don't pay anything out of pocket. When they approve or say we're going to take your case, they're going to ask you for general information. They're going to ask for your doctor's records, or they may have you sign releases so they can get that information for you, which is to your benefit, because they know how to file these paperwork and make sure it's right the first time. Um, Generally, when you have been approved for disability and they are working on your behalf with the Social Security Department, so they're getting information or getting requests or whatever, talking directly with the Social Security Department. After you're approved and you find out what your benefit's going to be, even if they have to go back months or a couple years for your benefit as to when you were first considered disabled and you're approved for disability, they take a percentage of that amount. So if let's just say you were approved and your benefits was $20,000 and that was back pay or whatever from the time of disability to you get to approval to that particular date, then they will take probably 20%. And I think 25% is generally the most they can take for their services.
That was excellent. Thank you so much. That's way more information than I was imagining we'd be able to get. So I appreciate your expertise there, Diana.
Mhm.
We're going to keep it open for just a few more moments. We've answered all the questions in the Q&A. So if you do have a question, get it typed up real quick and we will make sure it gets answered. I just want to bring up, we've talked a little bit about appeals off and on, and I know you and I have talked offline about a potential webinar in the future specifically for appeals. If you were just giving people quick advice about how to make an appeal if they needed it, let's just say around medication, what's the best way to go about that?
Okay, first, if you were not approved for a medication, first of all, you need to look at your plan. If it's Medicare, especially, see if it was even covered on the formulary. Um, Sometimes your doctor will say this medicine is necessary for you. And if you can't find the coverage for it or get assistance, okay, again, have an appeal from your doctor. Your doctor needs to write this to your insurance company so they can look at it and say, well, maybe we will cover it under this instance. And if you find you can't cover it, or if you're going from one medication to the other, there are pharmaceutical companies that will help bridge that gap while you're in the process of getting this appeal done. So um, I wouldn't walk away and say, okay, that's it. I'm not going to get this medication. You don't want to do that. I'm telling you, pharmaceutical companies will be glad to help you. So that's under prescriptions. Always make sure though that your prescription plan is going to cover what you're taking now and what you anticipate to be taking in the future, especially if you come off a remission and you already know what the next line of treatment will be. Stay in communication with your doctor. Know what your plans are now and plan for the future. Um, Other appeals, Social Security disability or regular appeals, like you need to know the appeal process. And generally, when you get EOB back, they will tell you for treatments, they will tell you how to file an appeal on every single EOB. And you need to be aware of the time constraints on filing an appeal.
Thank you so much. I actually used this recently with a medication for my husband, so I was very grateful, Diana, that I captive audience here for these webinars because it was personally helpful to me. So thank you so much. All right. We've got a question kind of following up on the disability lawyer question. Just asking, is there a limit on the number of months of back pay they can take? For example, if it takes 2 years to get approved, is it 2 years of back pay less the 5 month waiting period?
It's what you are approved for. The Social Security Department will already take out that 5 months and they'll say, this is what your benefit's going to be. Your back pay is going to be, let's say, I say $20,000. That's what you're expecting your check to be. They'll also look at Social Security income see if you're entitled to that. And I'm telling you, a lot of times they may not, Social Security Department, even though they take forever saying that we're looking at this, make sure you get the right amount, they may come back and say we overpaid you. It's a common error, and I don't understand why. But it's whatever, let's say that your final, this is what we're paying you back pay and $20,000, then the employer will get 20% or 25% or whatever they're allowed of that. And it goes directly to them from the Social Security Department. Does it come to you for you to pay them? The Social Security Department will cut a check for that employer.
Perfect. Thank you so much. I think we've got through all the questions for today. We got quite a few that were answered through our Q&A. So just want to thank you, Diana. Is there any final words you want to let us know of, or?
There's one thing that's very pressing, and it's concerning. There's a cap on Medicare Part D prescriptions of $2,000 for the drugs that are covered under your formulary, under your plan. There is rumor that that 2,000 cap will be going away. That is going to be huge for a lot of our patients. And it's things like this that I think you need to sign up for Financial Connect, because these are things that I'm going to keep you up to date on. A lot of the costs for the copays, deductibles, max out-of-pockets have not yet come out from Medicare. They will be coming out end of this month, all in September, so you don't know what's going on in October. Please sign up for our September webinar. It is going to give you everything we know up to date with the cost of Medicare prescription plans, what the out-of-pockets, what the limit's going to be, as well as your max out-of-pockets for Plan D. Now, with that being said, because our federal government has the right to change things when they want to change things, just because they go in effect, supposedly, you know, beginning of the year, 2026, does not mean that they're not going to change for 2026. So in the event that max out-of-pocket changes mid-year, you need to be aware of it. You need to look at your prescriptions, make sure you know there's biosimilars out there, make sure you're aware of what pharmaceutical companies have available to you. So if and when those times come, you're ready to pivot on a dime. Also reach out and start getting these grants if they're available. LLS was available last week. HealthWell was available. Try to sign up for these grants before those grants go away. They go from the month you sign up for them and approved for it for 12 months, which means you may be giving yourself a bridge in the event things start happening outside of the normal 24-month or calendar year.
Perfect. Thank you so much. And I've got a question in here just about the phone numbers for pharma companies. We will make sure we get that. Thank you so much for that comment. We will make sure we get that covered as well. All right. Well, thank you again, Diana. I love these open Q&As. I learned so much. I know our audience does as well. I've got that Financial Connect QR code up on the screen. Make sure you get in there and join if you're not already a member, and we will go ahead and close out today's webinar. So as a quick note, as you leave the session today, I'd appreciate you taking the 2 to 3 minutes to fill out the survey about your experience. The survey will appear as a pop-up once you close out of Zoom. This just helps us tailor our efforts towards topics that are most meaningful to you. I've got our upcoming events on the screen. So number 1, we have on August 6th, if you're in the Chicago area, you can join us virtually at 7 p.m. Central Time to discover all the incredible ways HealthTree empowers patients, drives research, and accelerates a cure. This is your chance to learn, connect, and take action. Then our Black Health Group is having an in-person event in Atlanta on Monday, August 11th at Mary Mac's Tea Room. This event is dedicated to creating a space where Black patients and caregivers can connect, share openly, and be supported. These sessions offer space to share experiences, ask questions, and receive information to help navigate care, make informed choices, and feel empowered along the way. And we've got one more event Our fourth annual Black Health Movement Challenge will be held virtually Friday to Saturday, August 15th and 16th from 8 a.m. to 5 p.m. Eastern Time. Walk, run, dance, or ride your bike to raise awareness, advocate for greater Black representation in clinical research, and support the African American blood cancer community. Join solo or gather a group of friends and win prizes. If you're interested in registering for this or any of our events, please check out the registration page through healthtree.org. I'll also send the link to sign up in the follow-up email. I wanted to highlight another one of our in-person events we have happening throughout the country this year, and we will be doing it next year as well. This is our Connect Cures events. These are live in-person events that are meant to bring resources, support, and valuable connections directly into communities. If you're located in any of the cities shown on the slide, we'd love to see you at the event. And also, if you'd like to help us spread the word in those areas, we always appreciate that as well. Nothing counts more than a personal invitation, so we thank you in advance. We've got the QR code on the screen. I'll also include that in the follow-up email as well. I'd like to again thank our sponsors: Pfizer, Adaptive, Kura Oncology, Johnson & Johnson, GSK, AbbVie, Amgen, and Taiho Oncology. And as I mentioned, I've got my email up on the screen, so if you weren't able to jot down Diana's information, I'm going to leave this up here. You've got time to grab a pen and paper, reach out to me. I'm happy to get you in contact with Diana, make sure you get the resources and answers that you need. Also, you can jump on healthtree.org and get connected through our Connect groups. I really do appreciate you being here today, and I hope to see you again.